Nou kan ek hoes, want ek het 'n krapperigheid.
Hoe som uit?
Dankie.
Is jy okay?
Was in my net sê die prof sê dit was in my elmboog.
Ja, goed nee, ons sal vir hom gerus stel in 'n oomblik van nou. Maar jy is okay. Dis al wat ek wou weet. Wits het die eerste Covid-19-entstowwe begin toets in Suid-Afrika en die hoof van hierdie projek, Professor Shabir Madhi, kuier vanoggend saam om hieroor te gesels. So good morning Professor Madhi, and thank you so much for joining us this morning.
Good morning, Elsa. Thank you for having me.
I would like to start with some background regarding the research.
So also where we are currently, as you know, we're actually doing 2 COVID vaccine studies now. The second study we in fact started just at the beginning of last week. And in both instances, what happened is that we went out engaging with different individuals and different groups to see if they would be willing to come to South Africa to do these vaccine studies, because it's essential that we understand how these vaccines work in the African context, and particularly at this stage of where we are in the epidemic. So that's how these 2 vaccines have come to South Africa. So one vaccine is developed by the University of Oxford, and the other vaccine is developed by Novavax, which is a biotech company in the US.
And how is the research progressing at this stage?
So with the first vaccine, the one from the University of Oxford, which is more advanced in terms of its evaluation, currently we've enrolled just over 3/4 of the participants that we were targeting. We were planning on enrolling 2,000 volunteers, and right now we're at about 1,500. So with that vaccine, the participants need to get 2 doses of vaccine, so many of them are coming in for a second dose. And then we continue following up the participants up until roughly when 42 participants develop COVID-19, at which stage we would be able to do an analysis to see whether the vaccine protects against COVID-19 or not. So we don't have that answer, and it's difficult to predict exactly when that will happen because it largely depends on the amount of virus that's circulating in the country. With the Novavax study, as I mentioned, we just started a week ago, so it's still at an early stage, and we're targeting enrolling about just under 3,000 participants in that vaccine study. So that's going to be some time. It will probably take us at least 6 to 8 weeks before we complete enrollment into the Novavax study.
How concerned should we be at this stage when considering the latest infection numbers?
So I think South Africa is sort of at a stable state, although the amount of testing that's being done has decreased, which makes it difficult to fully interpret the numbers. All indications are that the majority of provinces, including the Western Cape, including Gauteng, including the Eastern Cape, are on a downward trajectory. But that doesn't mean the virus has gone away, because the rate of hospitalization is still fairly high, although much less than what it was at the peak of the outbreak. So in terms of the numbers, like I said, because the testing rate has changed in the country, it makes it difficult to understand whether the 3,500 that were identified on Friday is comparable to the 12,000 that were being identified per day at the peak of the outbreak. But I think in general, the situation is improving. There is less infection taking place, but part of the reason why there's less infection taking place might well be that a significant percentage of the population, far in excess of the 600,000 people that have been reported, have already been infected. In fact, my estimate is that the true number of people that have been infected in South Africa is probably at least 7 to 10 times greater than the 600,000 that have been diagnosed, because the amount of testing that we've done, although the most on the African continent outside of Mauritius, are still legs behind the amount of testing that's done in many other high-income countries.
Professor Madhi, how practical is a lockdown period, or extended lockdown period for that matter, in terms of prevention as well as the economy? What is your take?
Yeah, I don't think there's any opportunity to go back to a higher level of lockdown. I think the lockdown had a specific purpose which it served, and that was to buy time for the healthcare facilities. But in terms of the transmission of the virus, it actually achieved very little. It slowed the transmission slightly, but all that it did was it moved the peak of the outbreak to 3 to 4 weeks into the future. Beyond that, it didn't really achieve much in terms of the amount of people that have been infected, in terms of the number of people that have died possibly. It might have decreased that slightly, but in general, the lockdown's main achievement was to buy time for some healthcare facilities to better equip themselves. And that differed between provinces. In some provinces, they were more successful with it than others. The lockdown has had a severe impact in terms of the livelihoods of people, in terms of the economy. So there certainly isn't, that shouldn't be considered as an option. What's more important is for South Africans to buy in as a collective to the non-pharmaceutical interventions, to wearing a face mask, the avoiding of overcrowded spaces, and adequate ventilation. Those issues are key if we are wanting to control the rate of transmission until hopefully we have a vaccine that becomes available sometime in the future.
And then lastly, how would you describe the importance and role of research within this regard?
I think it's absolutely necessary, and that's the reason why we're doing the vaccine research right now. It probably provides the best opportunity in terms of accelerating the time when we're able to control this virus and declare the pandemic to be over. As you probably heard over the weekend, the Secretary General of the WHO indicates that it will be at least 2 years before the pandemic is considered to be over. Research has also been helpful in terms of us better managing individuals that were hospitalized with COVID-19. South Africa was relatively fortunate in that we were able to gain from the research that was done in other countries where the peak occurred much earlier in terms of the type of management that they were able to investigate. And because of that, we were better prepared as to how we managed the individuals that ended up in our ICUs. So as an example, unlike the United States and United Kingdom, where at the peak of the outbreak, 70 to 90% of people that were being ventilated died, in South Africa, that number was much lower. It was about 50 to 60%. So it's still a lot of people that were dying that ended up in ICU, but much better than what was being experienced in the United Kingdom and the United States. And a large part of that is because of the research that was done in those countries, which provided us with the tools to better manage individuals that ended up in our ICUs. So it's absolutely necessary if you're wanting to improve outcome, as well as eventually if you're wanting to prevent illness from this particular virus, that we undertake research. It assists us in terms of informing what needs to happen, and we become much more efficient in the manner which we go about doing things and achieving things.
Thank you so much indeed. Dit was dan Professor Shabir Madhi, 'n enstofkundige aan Wits Universiteit.